Bonjour.
Hello, my name is Éric Veya, and I am the head of the Institutional Steering Committee at the Neuchâtel Psychiatric Centre.
Hello, my name is Philippe Courvoisier, and I am head of the Clinical Quality Office. The CNP is a cantonal public institution, and its mission is to implement the health policy of the Canton of Neuchâtel in the field of mental health care.
Our missions are mental health care ranging from outpatient consultations to specialised services, daytime activities, and also hospitalizations in cases of crisis. We treat approximately 10,000 patients annually, with 650 employees spread across 52 professions. As head of the Institutional Steering Committee, I am responsible for managing internal projects. In collaboration with the Clinical Quality Committee, we had an essential need to address, bringing intelligent digitalization to the institution. We wanted to implement a workflow solution. This solution had to be simple so that it could be managed as closely as possible to the field. We were also looking for a no-code approach to create procedures without extensive knowledge of computer language.
To start our project to digitize the institution, we identified an initial problem: reporting and handling adverse events. In psychiatry, this process includes assaults, falls, medication errors, and suicide attempts, among other things. Reporting these events is not only mandatory, but essential if we want to improve clinical practices and prevent these events from happening again. The existing forms made it difficult to complete the report systematically, and the process of passing this report from one person to another was very slow. To be useful, such a report must be made quickly in order to provide relevant support for improvement to the healthcare team. We worked with doctors and nurses to completely redesign the reporting form and incorporate relevant clinical questions. We then made most of the answers structured and mandatory to ensure complete results that could potentially be reused in clinical research, for example. Today, the results are clear. The reports are complete, transmission times have been reduced, and the data collected is more clinically relevant. This enables our Clinical Practice Review Committee to propose targeted improvement measures.
From the outset of the project, internal stakeholders are involved in developing the solution. The bulk of the work involves updating and formalizing processes and defining responsibilities. Once the concept is clear, the teams test the process, suggest improvements, and validate the various elements before going live. The teams are generally very satisfied. Managers can monitor deadlines and identify bottlenecks. In about 10 months, we have put about 15 processes into production. Mainly focused on the clinic, these processes also benefit the finance department, management, and its secretariat. The deployment of these processes allows for an analysis of practices and a clear definition of responsibilities, guaranteed traceability and detailed analysis at every stage.
Management meetings are now more dynamic and interactive. They focus on discussion and decision-making around the dashboards provided by the solution.